Recent research shows that if 90% of families were to exclusively breastfeed, then nearly 1,000 infant deaths could be prevented. The United States could also save $13 billion per year. My name is Morgan Lewis, and I am here to talk to you about the importance of breastfeeding and why I am for it. Not only have I done extensive research on breastfeeding, but I also intern at a health and wellness department where I help pregnant women and lactating mothers on a daily basis. Breastfeeding improves the health of babies, mothers, and our communities as a whole. Our economies also benefit from breastfeeding. Now let's get more into it. The cells, hormones, and antibodies in breast milk protect babies from illness and disease. This protection is unique, and bottled formula could never match the chemical makeup of breast milk. Breast milk can reduce the risk of type 1 diabetes and sudden infant death syndrome. The activity of sucking at the breast enhances development of babies' oral muscles, facial bones, and aids the optimal dental development. Lack of breastfeeding increases the risk of ear infections, obesity, childhood cancers, and allergies. Breastfeeding is an essential means of providing food security for millions of infants worldwide, and even more so in developing countries and regions having to cope with war, conflict, population displacement, natural disasters, and ecological crisis. A study by the National Institute of Environmental Health Sciences showed that children who are breastfed have a 20% lower risk of dying between the ages of 28 days and 1 year than children who are not breastfed. With the longer they are breastfed, is associated with lower risk. Another study done with 4,000 children showed that children who were breastfed had a significantly higher scores on a vocabulary test at age 5 years than children who were not breastfed. Breastfeeding affects our youth in so many ways. Now let's see how breastfeeding affects our mothers. Breastfeeding provides a unique interaction between the mother and child. An automatic skin-to-skin closeness and nurturing that a mother who does not breastfeed has to work on in order to replicate. Women who lactate for 2 years or more reduce their chances of getting breast and ovarian cancers by 28%. Breastfeeding also helps a mother lose weight after birth. Mothers burn many calories during lactation as their bodies produce milk. When a woman gives birth and proceeds to nurse her baby, she protects herself from becoming pregnant again too soon. A form of birth control found to be 98% effective. Women who have breastfed are at lower risk than mothers who have not breastfed for developing high blood pressure, diabetes type 2, and cardiovascular diseases, in later decades when they get menopause. The benefits also increase with the duration of past breastfeeding. Finally, let's see how breastfeeding benefits our societies as a whole. Breastfed babies are sick less, which can lower healthcare costs. Breastfeeding contributes to a more productive workforce since mothers miss less work because they do not have to care for sick infants, leading to employer medical costs being lowered. Breastfeeding is better for the environment because there is less trash and plastic waste compared to formula cans and bottled supplies. Breastfeeding also leads to a reduced tax burden on communities to ensure children are properly fed. Breastfeeding is more economical than formula feeding. The cost of bottled formula for 12 months is $1,000 to $1,200. In conclusion, breastfeeding improves the health of babies, mothers, and our communities as a whole. Our economies even benefit from breastfeeding. Today's youth could be our country's future leaders, and the nutrition they receive now is vital to their growth and development. Breastfeeding needs to be part of our society, and families need to consider it to be part of their infants' feedings.